y'all, my Be Health Empowered family. Welcome back to another episode of Excuse Me, Doctor. My name is Dr. Melissa Clark. I am delighted to be here. Many of you already know me as Dr. Mel, but for our newbies joining us, welcome, welcome, welcome. Welcome to the Be Health Empowered family. And I just got to let y'all know, for those who tune in all the time and the newbies, the reason we are here. We're here for you. We're here to make sure that you're getting the right information that you need to make sound health decisions, not just for yourself, but also for your family and for your community. And if it's your first time joining us, please make sure to hit that like button if you're checking us out on Facebook. And if you're over on YouTube, hit that red subscribe button. We really appreciate you for it. Make sure that you get all the updates related to the show. And for those who ride with us all the time, you know that I can't do this without my wonderful, wonderful, wonderful co-hosts, Mr. Wayne Bruce and Miss Lila Mayes. What y'all talking about this week?
Hey, everybody. We can't hear you,
there?
Brother Wayne.
Yeah,
Always
Brother
happens.
Wayne.
Is
I don't
Mercury
know.
in retrograde?
Oh no,
He
something might be.
he
It
always
might not be
blames
Mercury. It
me.
might be something else.
Might be my technology in retrograde. Good God. How's everybody? It's the Wayne Bruce. No, it's excuse me, doctor. So.
Right.
Let's get it straight. Let's get it straight. We don't want to confuse the Be Health Empowered family out there.
We don't, Doc. We don't. You good? How are you?
I'm good.
We all standing around like we good, like we don't have a show to do.
Show today? What's going on? What are we talking about today? I mean, this is like a producer show, really.
It is.
It is. So we decided to do this show because recently I was in services of a hospital.
Yes.
And sometimes people don't come out of the hospital. So we wanted to make sure that you have all you need to get through a hospital stay and beyond that. Right. So we decided to do the show around that, right, Dr.
A
Mel?
hospital stay and a rehab stay.
And a rehab
right.
stay.
Or if you're going home. Some people go home straight from the hospital and their loved ones, don't know what to expect. So how can you plan for that effectively? And I know, I've been hospitalized before, and even I feel vulnerable and helpless. And even when my loved one is in the hospital, I got to get my armor on and get ready to advocate for them. And so that's what this is all about. We want to give y'all the tools to make sure that you're ready if someone that you love ends up in the hospital, to advocate for them, advocate for their safe and successful treatment. And then as they're discharged, transitioning to whether it's rehab or home or wherever, that y'all can get it done.
Right.
We're excited about that.
Yes.
And so who's the guest?
So we have an incredible guest this evening, everybody. I want everyone to stay tuned. Have an incredible guest, Harvard educated physician. I mean, world renowned. Could I say that, Lila?
Sure.
World renowned physician.
Absolutely.
Dr. Melissa Clark with the E.
Yeah.
Dr. Melissa Clark. I can't hear it loud enough.
Gotta love the sound effects. Gotta love them. So yeah, it's gonna be exciting. I can't wait for y'all to interview me.
Okay.
Yeah.
We have questions.
We have questions. But before we have those questions, we have to go into the week that was.
That's right.
In health and wellness.
It's a weekly recap.
Okay. All right. I see our sound effects game has gotten stepped up.
It's not the greatest.
I stand impressed.
It's not the greatest, but I do what I can.
All right.
Yeah. So kick
So
us
look,
off.
so so let me start this thing off, man. I'm acting silly and I'm not even paying attention. You know, what is sepsis? I mean, we've heard this word before it came up on Oprah in the VP uh, Harris discussion with the families of the two women who died due to lack of care related to restrictive abortion laws. Amber Thurman is the name of one. She specifically died of sepsis. And we hear that term in death a lot of times. I know, unfortunately, I heard that term when my mom and with my brother who passed.
Mhm.
They passed of sepsis. What? And I asked them then, they couldn't give me an answer. What is sepsis?
So, I can tell you what sepsis is, and the reason we thought it was important to talk about this week, is because it came up in that VP Oprah interview, and how it's coming up when we're talking about reproductive justice. So, it's terrible. It's a terrible illness, and of course, for your mom and for your brother, um, it is unfortunately something that can be life ending.
Mhm.
And it occurs when your body has a overwhelming response to an infection, so overwhelming that it actually causes your tissues and your organs to start to shut down. And when they shut down, um, unfortunately, death can result. So, sepsis can happen from an infection anywhere in your body, really.
Wow.
But the way that it applies specifically to abortion and what happened to the young lady and the family that the vice president was talking to in the Oprah interview is that when you take the pills that help the uterus to push out the fetus and the fetal tissue, very rarely, like less than 3% of the time, they don't work in terms of pushing out all the tissue. And if that
Mhm.
tissue then remains in your uterus, partially aborted, then that can cause an inflammatory and an reaction that leads to sepsis. Um, and what happened with Amber Thurman is that she was afraid to go to the hospital to get care because it was illegal in Georgia to use these pills. She actually had mail ordered the pills from another state. And so that's
Oh,
really one
Wow.
of the concerns with these restrictive abortion laws varying state to state is
mhm.
that people are afraid to go for the care that they really need, and had it been administered under the care of a doctor, it would have never happened, so hence they ruled her death preventable. Um,
Wow.
and this is something that, reproductive justice is sorely needed to prevent
Ugh,
these deaths, and they're happening disproportionately to women of color
of
because they
course.
are often the ones that lack the resources to go to the
Right.
states and get the best medical care um, when it comes to choosing to end a pregnancy.
I have to tell you, I was in the audience that day. I was, invited to be on the Zoom for that, and
Mhm.
I had to stay facing the camera, but I was just a ball of tears through that whole story.
Yeah,
It was that's just one, but that was such a heartbreaking story.
it's so senseless. It
Yeah.
is so senseless on so many levels. But yes, so that's what sepsis is, y'all.
Yeah. Unfortunately, yeah, I just want to say it's a terrible thing because people pass from it.
Yeah.
I mean, um, and you never know the repercussions of all those things. But on a brighter note, I just want to focus on a brighter note. I want to say, I want to shout out our co-host Lila Mayes because she was a associate producer and producer on Musicians for
For
Kamala.
coming. Thank you.
Yeah,
Thank you
and
for
she
that.
was invited by Oprah personally to be on that call. You know, like She was invited by Oprah personally, and she knows Oprah.
All
And the
right
fact
now.
that in fact, her and Oprah always hang out on the yacht.
Stop it. Stop it. Stop it.
She has replaced Gail.
Watch out. We might
I'm
be
not
bordering
saying
on
anything. I didn't see
misinformation.
Gail on
We,
camera,
we
but
do
I
not
saw her.
traffic in misinformation on Excuse Me, Doctor.
Right.
I'm sorry. I'm sorry. I got carried away.
All right. Moving on to number 2, urinary incontinence, Dr. Mill.
Yeah. So a lot of women, this is sort of like a silent thing for women in a certain age group who kind of
Yeah.
deal with it, without letting other people know. But the good news is that a study showed that 12 weeks of doing yoga cut urinary incontinence episodes among the people that participated by an average of 65%. That is in the range of the medications that people take for incontinence, right? But
Wow.
unlike
Yeah.
medication, it's a lot lower risk. Plus, it has other health benefits, right? Like
Yeah.
lowering your stress levels and your cortisol levels and getting better sleep and all that good stuff.
And this is a topic that women don't talk about a lot, but it really is common, especially for middle-aged women, like half of middle-aged women, and like 80% of women aged 80 experience urinary incontinence, and it can be really embarrassing and anxiety provoking.
Absolutely. And in addition, it's also a risk factor for falls because
Mm,
women who are elderly trying to get to the bathroom in time, or especially if it's in the middle of the night, might fall and unfortunately fracture or break a hip. And, of course, that can be devastating at a certain age. So it's a pretty serious problem.
so is this due to the the yoga? Wait, help me understand, Dr. Mill.
Okay. So it wasn't just an effect of them exercising, right? It was specifically the yoga.
Okay.
Um, so they were doing yoga moves that also, in addition to general yoga, specifically help to strengthen their pelvic
Um,
floor muscles.
okay.
And so, and they had a comparison group of people who did sort of general exercise for the same amount of time, which was 2 times 90 minutes a week.
Okay.
And the benefits only were seen in the women that were doing the yoga with the pelvic floor muscles, but
Alright.
strengthening exercises.
I
So
see.
yeah,
So
something to spread the word about.
for sure. Somebody commented, "Strengthen that pelvic floor."
Right,
There you
right,
go.
right. And
Right.
and and Dr. Mel, I'm interested because men don't talk about this either. Because the same thing has happened to men, and we
Mhm.
Yeah.
don't talk about it. I wonder would it help men? I mean,
Theoretically, of course, like I said, the study was only done in women, but theoretically, it's the same set of muscles, right? So
mhm.
theoretically, it could work in men as well.
So when
The study
look at all
remains to
my
be done.
buddies, instead of my buddies going to the golf course, they're going to yoga class.
There you go. There you
Oh
go.
no, that
Hey,
might be
and
good.
like I said, yoga has other health benefits, so
Yeah,
it could work out for them.
Wow.
that's really interesting. That's an interesting thought there. I'm gonna have to get back into my yoga.
Yep.
Okay.
There you
All
go.
right. Look, we always talk about food as medicine. And, you know, I just put up, don't sleep on broccoli because broccoli is my favorite. My favorite. Favorite. Don't talk. I don't want to hear nothing about Dr. Wawa says don't eat broccoli. And some people out there don't eat broccoli. I'm just saying.
And I don't understand that because I love broccoli too.
Me
And the
too.
thing is that it might have some mild blood pressure lowering effects along with other cruciferous vegetables. So what's in that family? Not just broccoli, but cauliflower and kale. And so there was a study done that showed that if you get 4 servings of those kinds of vegetables a, a day over a 2-week period of time, that's as long as the study lasted, it showed that compared to folks that were just eating root vegetables, so that's
Mm,
like potatoes and
mhm.
squash, whatnot, that they had the group that ate the cruciferous vegetables had lower 24-hour blood pressure readings on average of about 2.5 millimeters of mercury. Okay, so that means like if your normal blood pressure is 120/80, theirs was like 118/80, right?
Okay.
Or 118, oh, sorry, 117.5/80.
Mhm.
Hmm.
So, yeah, it doesn't sound like a lot, but that could be significant.
Yeah.
So just to let people know what's a serving size is a cup or about 8 florets, right?
Right,
Because I know
exactly.
broccoli and I know they have florets. You gotta say it like that. Well, it's not legit. 8 florets.
Okay.
Just so that the people out there know. So you when you talk about your 4 servings, we're talking about 4 cups of broccoli or 32 florets, okay?
Florets. Look,
So
but I also know
uh
because I research these things that it
mhm.
helps reduce your insulin spikes also.
Hmm.
Yes, yes, so you're getting a twofer, right?
Hmm.
Super.
Um, and when it's specifically is talking about the blood pressure, like I said, even though that 2.5 millimeters of mercury might not seem a lot, over time, each of those little drops in your blood pressure over time has a beneficial effect for your heart in decreasing your heart attack risk by 5%. So every little bit counts.
Yep.
So, you know,
So I see someone put
knock
in
up on
the
that broccoli.
I see someone put in the chat that broccoli we eat is a natural broccoli. It's been altered. Don't eat any GMO broccoli if you can. And
And you can
yes,
always grow
it's
your own,
you grow your own broccoli
right?
because you need those florets.
Exactly, and if it's not broccoli, it can be cauliflower, it could be kale, it could be spinach,
The
but the key is
cruciferous vegetables.
eat your green leafies. That's the key. Cut down on your salt and monitor your blood pressure and work with your doctor, in terms of making any changes. Just don't go out there and substitute your blood pressure pill for cauliflower.
Right.
Don't do that.
Right.
Yeah.
Maybe don't do that.
I got a bag. What you carrying around, Miss Johnson? I got a bag of broccoli, and I'm trying to. My doctor, I saw on Dr. Mel's show that she said it lower your blood pressure. Miss Johnson, your blood pressure is 200 over 100.
Work with your doctor.
Work with your
Work
Cut
doctor.
down on your
with
salt,
her.
get your exercise and your sleep.
All right.
All of that works together.
But
All
Wayne,
of
you
it
made a
works.
really good point. You made a really good point. I'm glad you broke down like the florets and stuff because when people hear 4 servings of broccoli, that sounds like that is a lot,
Yeah.
right?
It's not.
It's
But I could
not
eat
though.
2 cups in one sitting. I could eat 2 cups of
Yeah,
broccoli. Yeah.
easily,
Yeah,
easily.
easy.
Right.
Yeah.
There you go. Put a few in a salad, stuff like
Yeah.
that.
Yeah.
So look, that's the end of the recap. You know what that means.
Tell us.
I'm just saying.
What y'all think? It's time to bring y'all in. Get ready. Get ready to put it in the chat. What y'all think?
So this week we asked the people if they thought there should be a warning label on social media apps for ages 17 and under. And I have to say, I put the poll in 2 different places on 2 different platforms, and 100% of the responses is yes. I thought that was
Wow.
interesting. I thought people would say no. Nobody said no.
And I think the second part of that is, well, just a little bit of background. There's been a lot of
Yeah.
research that shows that social media is linked to, or social media over 3 hours a day in teens is linked to depression and feelings of social
Mhm.
isolation. And so the Surgeon General has been advocating putting this warning label on social media. So, sort of similar to cigarettes and cancer. So,
Mhm.
I think that's a great response, but I'm also curious to know what the audience thinks. Do you think it'll make a difference if there is a
Right.
social media warning label? Like, will it cut down on the amount of time that teens spend on social media? So I want y'all to weigh in. Let me know what y'all think.
I mean, send this
Yeah.
to your friends. Ask them.
Yeah. Ask your friends because I did get a couple of comments like people parents need to parent and there were some
Mm,
of those kind of comments, but I I actually voted myself, and I said, "Yeah, I think a warning label is important." There's a lot of stuff that our young people are exposed to on these apps.
Yes,
Yeah,
Yeah.
absolutely.
yeah.
Absolutely.
So put it
All
in the
right.
chat. Send us. I mean, if you're watching this on any platform that you see Dr. Mel, I mean, IG, whatever. We're gonna cut this up and put it on IG too. Do you think it's a
Okay.
warning label? I mean,
All right.
Okay.
come on now.
Let us know.
And
All
that
right.
that'll be what y'all think.
What y'all think? All right. So moving along, we got some stuff to talk about.
Right.
Yes. Welcome to our illustrious guest this evening, Dr. Melissa Clark.
Yes. I just want to say, have you ever had a loved one in the hospital and felt helpless to do anything? That's all I got to say. Dr. Mel?
Yes.
Go ahead. So we're here. Our guest, the author of Excuse Me, Doctor, I've got what? Taking ownership of your health and making healthcare work for you. Emergency physician, patient advocate, health equity champion, former medical school dean, assistant dean, and keynote speaker, our guest, Dr. Mel. Dr. Mel.
I'm here and happy to be here.
It's our guest this evening. Hi, Dr. Mel.
Hi, Wayne. Hi, Lila.
Hi. We're going to pick your brain about how to survive a hospital stay.
And
Is
beyond.
that all right? And beyond.
Yes, I'm ready.
And we
Okay.
and we need questions. I want to first say this, go to our audience and our listeners and our viewers. We
Yes.
need your questions. Post them in the chat, and we'll get right on to them. Is that right, Lila? I'm going to throw it back to Lila. Or I'm
Yeah.
going to start this because this was about me, wasn't it? Am I
All
supposed to
right.
start this,
Mhm.
Lila? So look, I was recently in the hospital. And so I just, it didn't seem like a dangerous place to me. It just felt like, I was pretty interested in how they were going to cure what was wrong with me, right? But it didn't
Mhm.
seem like a dangerous place to me. But I've always heard, and some people don't make it out, what are the dangers associated with being in the hospital?
So, most of the time, people do well in the hospital, right? But
Mhm.
there are some risk to being in the hospital, which is why they try to get you out as soon as possible, right? And these are some of them. One of them is picking up an infection in the hospital, right? You're
Mhm.
going to be exposed to bugs that you wouldn't normally be encountering out in the community, bugs that cause pneumonia, urinary tract infections, bloodstream infections that lead to sepsis, like we were talking about. The longer the
Mhm.
stay, the higher the risk. Um, and then treatment complications. So whether the treatments you're getting are medicines and you have a medication error, like getting too much of a medicine or getting the wrong medicine by mistake, or whether it's a surgical complication like excessive bleeding or a reaction to the anesthesia or infection after the operation. All of those are possibilities. So, treatment complications. The third is falls. So, people getting up
Mhm.
unattended, going to the bathroom, not feeling well, not realizing that they are a little bit wobbly and falling and having injury. The other is the opposite, staying in the bed too long. So
Mm.
that leads to two potential problems. One is blood clots. You might have heard of a DVT, or a blood clot stands for deep venous thrombosis, the blood clot breaking off and going to your lung and causing serious, serious problems. Or the other thing that people don't think about is when you stay and you're laying up in the bed, especially for older people, you're losing about 2 to 3% of your muscle mass a day. So
Wow.
that
Wow.
means that if you're in the hospital for 2 weeks and you're not getting up out of bed and at least sitting up or trying to walk down the hall, your muscle mass is fading away, and it's going to be harder for you to get back to the level of function that you had before you went to the hospital. And then number 5, last but not least, are just staffing issues or errors in care that people make. So, because of COVID and even before, hospitals are now understaffed. And
Mm,
so that means that staff, are sometimes operating at the sort of end of um their energy levels.
Mhm.
There can be miscommunication that happens. And these things can lead to worse outcomes. So for example, um, an older person that can't turn themselves in the bed, unless there's a
Mhm.
staff person that comes along and turns them every 2 hours to make sure they don't get
right.
pressure sores, they might develop a pressure sore, and that might be what ends up keeping them in the hospital even longer. So these are things, and this can happen. All these things that I mentioned can happen in the hospital, or they can also happen in a rehab situation,
Mhm.
people who
Sure.
are staying in rehab facilities or nursing homes. So all these things have to be policed and thought about and looked about carefully.
Well, that's that was a lot of information, but that's
That was
great
a
stuff.
lot.
So, yeah, Dr. Mill, how can folks research the ratings and track record of the doctors, staff, and the hospital before a procedure? So this is a two-parter. And then is there a resource book, a resource or book, or organization that folks can refer to?
Sure. Well, let's talk about doctors first.
Okay.
We all know, like, the online rating websites, right? Like
Mhm.
ZocDoc, Health Grades. You can Google a doctor and sort of get some sort of sense, and reviews from other patients that have seen them. A more sort of official way is to go to the state medical board. And the
Mm.
state medical board is the one that licenses, gives doctors permission to practice in that state. And they keep a record of disciplinary actions, their licensing status, whether they're actually licensed in that state's any malpractice claims. So you can go to the Federation of State Medical Boards website, Federation of State Medical Boards, and check for your state what their website is, and then go to their website, that state's website, and look up whatever doctor you're interested in. So that's doctors. Hospitals. So the best place, kind of the one-stop shop, is to go to Medicare.gov, right? Slash hospital compare. And
Mm.
what they do is they do a rating scale from 1 to 5 of, they're called stars. You get 1 star to 5 stars. And the star summarizes a bunch of different things that they look at in
Mhm.
terms of hospital quality. So things like um, deaths, um, heart attacks, sorry, deaths after heart attacks or pneumonia. They look at readmissions, because sort of the mark of a good hospital is if they discharge you, you stay discharged.
Right.
You were improved. But if
Right.
they
Right.
have to readmit you, that means that, some readmissions are unavoidable, but
Mhm.
others occur because of, they didn't do a good job the first time around, or they didn't do a good job in giving you instructions and supporting you in what needed to be done when you left.
Okay.
So they look at stuff like that. And so they look at this rating system and let you know. There are also other groups that do that. I don't want to give you all too much information, but just think Medicare.gov is the go-to. But there's also the Leapfrog group, US News and World Reports, that also give rate hospitals based on their quality.
Okay.
The other good thing about Medicare.gov is it also rates nursing homes and rehab facilities. So
Mhm.
you can get the same information about those places too.
Fantastic.
Wow.
So, Dr. Mill, Medicare.gov/compare, is that what you said? I'm trying to make sure we drop everything in the
Yep.
chat.
So
Okay.
slash hospital compare.
Hospital compare. Thank you.
And if you're looking for the rehab facilities, I think it's care compare.
Okay.
Okay. Wow. 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 I have a question.
All
So
right.
when you're in the hospital, so you're in the hospital, how
Mm-hmm.
can you like actively monitor what's going on with your hospital stay during the stay? I mean, how
Mhm.
or how can somebody, maybe your advocate or loved one, monitor that?
Mhm.
Yeah, excellent question. Well, first of all, let's talk about your loved one. You
Mhm,
have to give the doctors written permission to talk to whomever you designate, right?
mhm,
Because
Mhm.
they have to, because of HIPAA, they have to
mhm.
sort of protect themselves to make sure that they're not divulging information to somebody who's not authorized.
Right.
The best way to do that is to have a healthcare proxy or a medical power of attorney even before you get sick,
Right.
and
Mhm.
have that paperwork intact, because you never know, you might end up in a situation where you can't give permission, right? So
Right.
that's good to just knock that out, get that out the way. You could probably get the form online. Um, Now, in terms of keeping track, either you or your proxy, the best person to always talk to who's the most available is going to be your nurse, your nurses. They're right there with you. They can give you some sort of general updates about your vital signs, your conditions, what your condition, what the plan is, say, for the next day, if you have any procedures scheduled, if they are changing your diet, you know, for whatever reason, not giving you anything to eat, for example, if you're going to have a procedure. So they can kind of give you those sort of general updates. But if you want the specific updates, you want to talk to the doctor who's in charge. That's called the attending physician, or it could be called the hospitalist. It's the attending physician if you're in a teaching hospital. That means if you have medical students, residents around, doctors in training, versus a community hospital that's not a teaching hospital, they're called the hospitalist. So those people do what are called rounds. Every morning they come around and go around and see the different patients. So it's called rounds. And it typically happens around the same time every day for you, right? So if they're rounding, say, between 7 a.m. and noon, they're going to hit your floor and your wing of the hospital around the same time every day. So you can ask the nurse the night before, hey, what time does the doctor generally get to my section of the hospital or get to my room generally? And you can have your family member advocate there, you know, to speak with the doctor to get the update at that time. You could have them, if they're not there physically, you can have them on FaceTime. The nurse will oftentimes help facilitate that, with the iPad or with your help you with your phone if you need assistance to get that person there remotely so that they can interface and talk with the doctor and get all your questions answered. So that's the best way to time it so that
Mhm.
you can hit that doctor or that team of doctors when they come around.
Okay.
Okay. Dr. Mill, what steps can I take to advocate for myself and communicate effectively with the healthcare staff to ensure I receive the proper attention and care?
Sure. So I talked already about, the healthcare proxy or the medical power of attorney. Definitely get that taken care up front ahead of time. Because it's always good. I say the squeaky wheel gets the most oil. And if you have somebody there, family there with you, or a proxy there with you advocating on your behalf, then you're the squeaky wheel, you'll get more oil, get more attention. Um,
Mhm.
the other thing is, if you don't have somebody like that, you can request from the hospital a patient advocate.
Right.
And these people are representatives that the hospital employs specifically for that purpose. If you're of a specific cultural background or speak a specific language, you can ask, that might not always be available, but you can always ask if there's a patient advocate that speaks your language or, is familiar with your background. Now, so that's the team to advocate for you. Now, what should you be asking? The first is always ask for and to see copies of all the test results and get an explanation for what they mean if they're not normal. Okay, number one, out the gate. Next, if you have a procedure, you've had surgery. Let's say before the surgery, ask what the risks of the surgery are, why it's important to have it, what will happen if I don't have it. 3 important questions. After the procedure, you want to say, hey, what'd you see? What did you take out or put in? And how is that going to affect my recovery? What are the next steps in my recovery? And how long is it going to take for me to get better after this procedure? Um, and if are there alternatives to these next steps, right? Do I have a choice? Because it's important that whatever the choice is, it's something that you're behind, because obviously you're going to be able to carry through with it if you believe in it and you're in favor of it and aligns with what your values are. So that's for a procedure. If it's a new treatment, kind of the same idea. You want to ask, what can I expect from this treatment? How long is it going to take to kick in? What are the potential side effects? Um, and then lastly, if you're being referred to a specialist, ask why. What is this person going to add to the picture? And what are their qualifications? Okay. Why did you pick this doctor over that doctor? So those are some of the questions that you should always be asking in order to advocate for yourself. And then the last thing is, what is between me and getting safely discharged? Right.
Wow.
And you want to know what that is so that you can track it every day. Maybe it's your blood sugar. Maybe your blood sugar has to get below 300. You want to know what that is. And you want to ask every day, what's the progress to that? And what are you doing to help me get there? So, what is between me and getting safely discharged?
So, wow, that's incredible. People don't ask that enough.
Yeah.
Go ahead.
I've never asked that. I was
Right.
just gonna say, so y'all better be taking notes and share this, because that was a nugget right there.
That right
That was a
there.
huge nugget. So, but that was the nugget. But Dr. Mel, so we're talking about. Oh, am I delayed? I'm sorry.
Yeah, you're delayed. So, can I cut in here, Eli?
Yeah, go ahead.
Because we got 2 people. We got Shauna Hall, who says, hi, we're a teaching hospital and we have a hospitalist. I guess that's a good thing. And then
Yes, that's true. I
Right.
didn't mean to make it seem so black and white. I was trying to make it simple. But yes, teaching hospitals have hospitalists as well. But typically, the head of the teaching team is called the attending, right? And the attending may be a hospitalist. But in a community setting, in a community hospital, meaning a non teaching hospital, the doctor that's in the hospital who's going to round on you every morning is always going to be the hospitalist.
Okay, cool, fantastic. So look, so also, Kim, I'm gonna butcher this name. I'm sorry. I'm gonna butcher your name, and I apologize up front. I do. But what you said,
He is nothing if not polite.
I am polite. Uh Kimutu to Achira, my sister. Be be a squeaky in a nice way, because the medical staff are human and it helps for them to feel respected and how we ask for information. She says, been a nurse for 27 years, seen it all. 27
Great
on.
point. Very, very fair point.
Yes.
Yeah.
Everybody's a human.
Exactly. And humans and back to the point of what I said about hospital staff, especially being since COVID, are short staffed. That means they're overworked. And that's also another thing to keep in mind, as you advocate for yourself and as you ask for information, but that you still have rights in terms of asking for information, and you always should.
And so I would like to say,
excellent point to that nurse, and thank you for your service.
thank you for your service. We love you. you part of the medical system, and I would say something to you in your 27 years, and you've seen it all. I want, you know, a lot of times, and I'm not trying to be offensive, but a lot of times people say, I've seen it all. And so they overlook the obvious because you've seen it all. And I would say, take everybody every day as a new person and a new thing that you cherish. You have not seen it all the time, because that person, you may not have seen that person. And all of us are equally, if not anything, different, right?
And important and
And
special.
important.
And I think that's part of her point too. If we treat each other
Each other.
Right.
like
There it
that,
is. There it
if
is.
the patients in the hospital and their families treat the nurses and the staff and the housekeepers, house cleaning and security,
Yes.
if they treat them with respect,
Yes.
and the same thing, all the hospital staff treat the patients and their families with respect, what a wonderful world that would be, right?
Right. And you may get
Right.
some florets out of that. Some broccoli florets.
So listen, we just Dr. Mill just answered how a patient can advocate for themselves, what questions to ask. But Dr. Mill, what important questions can a caregiver, spouse, family member ask who isn't the medical proxy? What can they ask that won't violate HIPAA?
Nothing. I mean, they're not going to get any real meaningful information. I mean, I think,
Okay.
the hospital staff can kind of say, the person's condition is guarded, or the person's condition is critical, or they're stable or improving. But other than that, you're not going to get any real concrete information.
Mhm.
So I think that's why it's important, to get that up front. If the person is a caregiver and they do have the permission to speak to the hospital staff, I would also add that in addition to the questions that I answered, to also start to think about discharge. So,
Mhm.
where there's that question, what's between me and discharge?
Yeah.
Mhm.
So, also on the other side of discharge, you as the caregiver back at home need to be preparing for this
Mhm.
person to come back home. So you need to
Right.
know what is my loved one's needs going to be when they get out of the hospital,
Wow.
right? Um, what home and schedule modifications do I need? Do I need to bring in a tribe to take turns, in terms of caretaking? Do I need to put up some handrails in the bathroom? Do I need to be taking up the rugs in my house? What do I need to do? You don't want any of that stuff to be a surprise. You want to make sure that that you have time to prepare both mentally and physically and emotionally for the changes that are going to come about to your lifestyle when that person comes back home.
Wow.
Yeah,
That's
Yvonne Smith made a really good point. She's like, you may not be able to get a whole lot of information, but you can certainly share information with the care team if you have been that person's caregiver, like they
mhm.
live alone, etc., that kind of thing.
Mhm.
Yeah.
Yes. And another really important thing, to the point of what I was saying about the hospital staff respecting the patient and the family. A lot of times what gets lost is, me as a doctor, and I've been a doctor over 30 years, seeing somebody laying in the bed in a frail or position where they don't have strength and energy, and they might not be themselves. That's your image of who they are, and you don't have in your head what their best is.
Right.
It's the job of, I think, their loved ones and their family and their friends or their caregiver to really paint a picture of, look, yesterday I was just talking to Johnny, and Johnny ran across the street to my house and knocked on my door. Paint a picture of what that person is like at their best, so that the hospital staff has an image of this person as a functional person, so that they know what to aim for. Because again, they might just think, okay, this person is sick, they need to stay in the bed. But if they know that this is a functioning person who takes care of their grandkids, who talks to their girlfriends every day, that image will sort of help guide them in terms of what the goalpost is.
Dr. Mel, it's so important that you said that. I remember when I was taking care of my dad in the hospital, and you said, bring a picture of him and what he
Mhm.
looked like before he had the stroke. He had a stroke and
Yeah.
subsequent other things. So they understand who they who he was yesterday. And
Yep.
that just what you're telling the folks that she's going to tell you exactly what has been tried and true.
Yeah.
Everyone, I mean, our guests, our guest this evening on her show is wonderful. And Kimutu Kimuntu, good God, I'm messing up your name, Kimuntu. I'm sorry, Achira. She says, definitely my brother. I am now in hospice and still as compassionate as I was in my younger days.
Awesome.
Fantastic.
Wow.
Fantastic.
Doubly
God
thank
bless you.
you.
God
It
bless
takes a
you.
special person to work in hospice and palliative care. So
Yeah.
double thank
Yeah.
you.
Yeah. And Rhoda Lawrence put up, bring a picture. Man, never even thought about that. Yep. Take a picture of what they look like. And so people won't just think of them as the sick person in bed. Thank you, Dr.
Yeah.
Mel.
You're brilliant.
And it's especially important in rehab, as you can
Mhm.
imagine, because they're the ones who are actively trying to get your loved one back to what their former functional status is or as close as possible. So that's doubly important to bring that picture, tell those stories, get to let the personalize that individual, your loved one, to the staff so that they're invested, they become invested in who that person is and
Right.
and how and the value, the joy that that person brings to whomever outside of that rehab facility.
Wow. Wow. So I think I have a question. If you don't have it, did we ask this question? If you don't have any family members or who can be at the hospital procedure, what steps should I take to ensure I am properly cared for?
Yeah, so I don't think it's so important that the person be present at the time of the procedure, right? You know, when the procedure
Mhm.
is starting, because you're not going to be in the operating room or the procedure room anyway. I
Right.
think it's more important in the lead up to the procedure, right? So going to the doctor's visit, um, and 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 then also being there on the back end when the person is in recovery. Those are the more crucial times. Um, but again, make sure that if it's before a significant procedure, that you have somebody who can speak to the doctor on your behalf. And again, you can also request a patient advocate um, if you don't have family members or friends who can sort of be there for you. They're also with your insurance company, you can also see if there are care managers that can
Mm.
sort of help you ahead of time prepare for the procedure and also know what questions to ask and advocate for up front and also on the back end. So that's another resource
Okay.
that
So
that might be available, and that
so
that includes, let me just finish. That includes whether you have commercial insurance, whether you have Medicaid, or whether you have Medicare. They all have care managers.
so Yvonne asks, who are the important staff after the surgery?
Mm. Yeah. So after the surgery, other than the surgeon, um, your rehab staff in the hospital. So those are your physical therapist, your occupational therapist. Your physical therapist job is to help get you mobile again. Your occupational therapist job is to help you reintegrate in terms of the things that you do. So, for example, um, using crutches, right? If you've had a hip replacement, being able to put your pants on. So functional things, whereas physical therapy is more strengthening.
Mhm.
Um, in addition, after the procedure, you're going to be thinking about how you're going to get out the hospital. So then you have your case manager who works at the hospital slash social worker slash discharge planner. They may be called different things, or you might have one of each of those. But anyway, it's their job to help prepare you for whatever your next step is. If you're going to go to rehab, or if you're going to go to back home, they help to make, once you or your family has chosen a rehab facility, they do all the coordination to make sure that you get to the rehab facility, the ambulance transfer, make sure all your medicines go with you. Um, or if you're going back home, similar, make sure transportation is arranged. And if you're going to need physical therapy, speech therapy, occupational therapy when you go home, they help to arrange for that, along with any sort of equipment, special equipment that you might need. So, like a specialized toilet seat, or a breathing treatment machine, any sort of medical equipment that you need in your recovery period.
Okay. So, on the flip side, like we have all the people to talk to ask the questions, get prepared. What if I don't like my care team? What if I'm uneasy? What if my nurse keeps not getting the right vein to stick my IV needles and stuff
Ooh,
into?
child.
Right.
Tell
That
me
has
about it.
too many
Right.
times in the hospital. How
Oh,
do we
that's
manage?
the other thing. I'm glad you mentioned that. The phlebotomist, I didn't mention that. But
Yeah.
they now have, some hospitals have people that if you have difficult to find veins, they'll use ultrasound to help find your vein. So you let people know up front, hey, you got one chance because I'm a really hard stick. And other than that, please, if you have somebody with ultrasound, please have them come around and help find my vein.
Great.
Mhm.
Okay, but if we, Dr. Mill, wanted to navigate this, I'm uneasy about my care team. Who can I reach out to? Are there resources or people inside the hospital or outside of the hospital that folks can contact?
Yeah. So I think the first person is the patient advocate. Most hospitals have them. You
Okay.
can start there. If it's a problem with a nurse or a nursing staff person, you can always talk to the charge nurse on the
Mhm.
floor. Or if the charge nurse is not available, or not compassionate to what your concern is, you can ask for the chief nursing officer, right,
Mhm.
of the hospital. Same chain of command with doctors. You can ask for the head doctor on the team, call the attending physician. If that's a problem, you can go to the head of their department. If that person is not compassionate, you can ask for the chief medical officer of the hospital.
Okay,
Um, and then you can also, if you have your own doctor out in the community, you can also call them and get their advice, depending on your relationship with them as well.
cool.
Because it might be a matter of them helping to transfer you to another hospital.
Right.
Okay.
So we have another question in the audience. Can family members stay with a person, such as a child?
Oh yeah, 99.99 times out of 10, you definitely can stay with a child. Depending on the visiting hours of the hospital and the hospital policies, if you get permission ahead of time, you can also stay with an adult. If they're in a shared room, though, probably not. Um, that would probably only work if you were in a private room. And
Mhm.
again, getting the permission of the nurse or the charge nurse on that floor to do so. But yes, generally is the answer, you can. Oh, the other exception, of course, is if there's a COVID outbreak
Right.
and there are COVID restrictions or some infectious disease issue going on. That's going to be a no go.
Okay. Wow. So let's go to rehab. Let's go to rehab because rehab is really important in getting us home, right?
Hmm.
What if your loved one has to go to rehab facility? What are the red flags I should be aware when looking for a rehab facility?
Yeah, this one is a one that requires footwork sometimes, right?
Mhm.
The
Mhm.
place to start off, again, is to go to Medicare.gov and look at the star ratings for that particular facility. If they're less than a 4 star, be concerned, right? Just like if you were going to stay in a hotel or, um, any other place, right? Um, the other thing is, again, you want to know what the timing is between the time the person's getting discharged and when they're going to rehab. Because if you have a day or two, spend that time actually going to visit some of the rehab facilities to check them out.
Yep.
And when you get there, yeah, you want to look for cleanliness and hygiene, smell. You don't
Yep.
want that urine smell in the air, right? You want to look at the appearance and the grooming of the residents there. Um, if they're poorly groomed, place looks dirty, no go, because that means the rate of infection is going to possibly be high. You want to look at the staffing ratio and do they have all the therapies that your loved one is going to need: physical therapy, occupational therapy, speech therapy, and the necessary equipment. You want to look at, how often are they going to get therapy? Are they going to get it every day? Do you have enough staff to make sure that they're getting therapy every day? You want to see if there's structured daily activities, because the person's, depending if it's an acute rehab, they'll probably spend 3 hours a day in rehab. If it's a subacute rehab, uh, they're probably going to spend an hour a day, right? Or half an hour a day in rehab. So they're going to have the whole rest of the day. So what else is going on? Do they have story time? Do they have musicians? Do they have
Right.
stuff, other stuff going on that will keep your loved one occupied and engaged? What's the quality of the food? Is it any
Yes.
good? I mean, I would say that's lower down on the totem pole because you can always bring them, goodies on the side. But yeah, that does add to the quality of life for your loved one.
So
Does the staff seem compassionate? And then finally, what is the policy around visiting hours? How often can you go? If they're very restrictive, I don't know if that's someplace that you'd want your loved one to be.
okay,
Mhm.
lie. What's been your you? I know you had a loved one in rehab or a facility, right?
Mhm.
What was
Yep.
your experience?
I have someone in, yeah, I've had people in both, and there's a facility here that's like the North Star. So I was always able to go in and out and come and go. But Rhoda made a really good point. I saw her in the chat say tour the facility. My sister and I, we did have to put, some boots on the ground and go and make some observations. But I found that that particular rehab facility was great because we had access to our loved one without having to call first. We could just show up and um, observe whatever they were doing
Great.
during the day. Yeah. So that kind of
Yeah.
stuff is important. Yeah.
So
Yeah.
Dr. Mel, we have about 30 seconds left here.
Mhm.
What's the point if you had to drive home one point, what would it be?
Yeah. Ask questions. Always ask questions. Don't be afraid. No question is a bad question if it has to do with you and your health. And always, look for the best possible option. Use Medicare.gov. And if it's a rehab facility, go in person and check it out, for your loved one, if they're going to end up at a rehab facility.
That's it. And so
All right.
where I mean, just where can they find more information about this?
They can always go to, excuse me, doctor, I've got what? Taking ownership of your health and making healthcare reform work for you. There's a whole chapter in there about surviving a hospital stay with, checklist at the end. And it also includes how to find out about, rehab, um, for your loved one. So thank you all for checking us out. Thank you, Lila and Wayne. Y'all are great interviewers, by the way. And to my Be Health Empowered audience, thanks for checking us out. And remember, be wise, be well, and be health empowered.